Hello, good to have you back in my channel. Alright, so today we are going to discuss on the different methods of family planning. We are starting with the natural method. Alright, so the natural method, or you can also call it the calendar method. Alright, so something like this can help you with the natural. So this natural method, you must know the length of your cycle. You must understand your body system, know if you have a 21 days, a 28 days, a 30 days, a 35 days, 32, 31 days, or 27 days. You must know the length of your menstrual cycle. And then if you know the length of your menstrual cycle, it will help you predict when you are going to ovulate. So this will help you prevent pregnancy. So this one is the natural method. All right, so you can do it, you can track it, you can monitor it yourself. Okay, so the second one is the emergency pill. So the emergency pill, you guys all know the emergency pill. So it's something that you take when there is an emergency. You take it once in a while. And if you have this emergency every time, because I know some people, their emergency is always every day, every time. So the emergency pill, so you don't use it always. All right, so if you use it regularly, it will interrupt with your normal menstrual cycle. It will interrupt, to make it irregular, you understand, it will affect your cycle. All right, so if you feel you have this emergency every time, so you can go, in fact you can choose other methods of the family planning. So the next method is the pull out method, you understand. So this one is for the guys that feel okay, that you see, but this one is not reliable, you understand. It's not reliable because mostly it's not all the guys that can actually do this, you understand. It's not all the men that can actually pull out their machine gun when the bullet is about to be triggered, you understand. So it's not all the guys, so this method is not reliable, you understand. So it's not reliable. So the next method is the barrier method, so which is the condom. So we have the male and the female condom. I'm sure most of you don't know that we have the female condom. All right, so I will do a video especially on this, how to use the female condom, and even the male condom, how to use it correctly, because some of us don't know how to use it correctly. Some of us, we open it with our teeth, we don't even know how to place it, how to, how to use it correctly. So I'm going to do a special video on this, how to use the male condom correctly, and also how to use the female condom correctly. So these condoms prevents pregnancy, and it also prevents STIs, all right, so the sexually transmitted infection. So for the female condom, you need to be well trained and showed how to use it, so that you can, be able to put it correctly. All right, so it prevents pregnancy. Okay, so the next one is the cervical cap. Okay, so it's still a barrier method, the cervical cap. So it's more of like a special type of cap that you put, that you place it at the opening, like at the entrance of your womb, which is the cervix. So you place it there, so it covers the cervix, so it prevents the sperms from getting into the cervix, and finding its way to the uterus and the fallopian tube. So it prevents the sperm from getting in there. All right, so but you need to be shown on how to use this particular cap. All right, the next one is the contraceptive pill. This one is different from the emergency pill. All right, so this contraceptive pill, you have to take it every blessed day. All right, so you take it every day, you take it same time, same. All right, so every day, so you take one today, tomorrow you take it the same time. So this one too, prevents pregnancy. All right, so it thickens the cervical mucosa, right? It thickens the lining of the cervix. It does not, it doesn't allow pregnancy to, happen. It doesn't allow fertilization to occur. All right. So the next one is the injectables. All right, so the injectable, so you take the injection every 3 months. Okay, so once you take it, it prevents pregnancy, thickens the cervical mucus. All right, so you take a small injection that you take, okay, so every 3 months. So then the next one is the IUD, the intrauterine device. Okay, so there are two types of this intrauterine device. Okay, so the other one is the copper T. We call it copper T. The other one is, still IUD device, but it's rich in hormones. Okay, so the one that is made up of copper, so copper and sperm are not friends. Okay, so once it's placed in the womb, so it blocks the fallopian tube, blocks this other side, blocks, so it does not allow sperm to find its way in there. And you already know, since sperm and the copper are not friends, so it makes the environment hostile for sperm to to stay or to survive. Okay, so the other one is the hormonal copper T. All right, so once it placed in there, so it releases the hormones, so to your body, makes the environment hostile, thicken the cervical mucus, will thicken the lining. Okay, prevents sperm from getting into the fallopian tube. All right, so that's how this one works. Okay, so the next one is the implant. Okay, so the implants, they are more of like, how do I even describe it, just like a stick of matches, like a stick of matches. It's placed under your arm. Your doctor will make a small incision, okay, under your arm, then put it there. It's placed there. Okay, there are some that can last for 3 years, the other one can last for as long as 5 years. So the releases their hormones into your bloodstream. Okay, so it prevents pregnancy, thickens the cervical mucus, call it bilateral tubal ligation. So the both fallopian tube are being tied. Okay, so tied. So and cuts yourself. So that means no fertilization. So even if sperms gets it, so there is no way it can fertilize an egg for pregnancy. Okay, so then for the male aspect of it, it's called the vasectomy. So the vasectomy there means that the tube that carries sperm from the testes gets to the penis there. All right, so the tubes, those two tubes are being tied and cut. All right, side. So it tied and cut. So that means that is all for that. It's a permanent method. Okay, so once it's done, so for the male, once you do this method, so you stay for as long as 3 months. You have to abstain from intercourse for as long as 3 months, so that some of the sperm may still linger around the tube. Okay, so you do not want any pregnancy to occur. So for like 3 months, so you stay away from intercourse. All right. Okay, so the last one is the abstinence. Okay, that one, total abstinence from anything that has to do with sex. Okay, so you will not get somebody pregnant. All right, so what I want to add is that for the implants, the one your healthcare provider or your doctor will insert here and put it under your arm. This one, it has some side effects like weight gain. Okay, it can make you gain weight, can make your breast tender. Okay, it can cause irregularities in your body system. All right, so can cause acne breakout. Okay, so that's why I said you should discuss with your doctor or other healthcare expert that are trained to handle it. So you discuss with them, so you choose a method that works better for you. So we've discussed the natural method. That means you need to know your cycle, know your body system, know the length of your menstrual cycle, know when you're ovulating, know your fertile period, so you can abstain from intercourse when you are on your very fertile period, so you abstain from intercourse. All right, so then the second one we discussed is the emergency pill. So you only take it when you have an emergency, and it shouldn't be a regular contraceptive for you. It shouldn't be a regular contraceptive, because if you take it regularly, it will scatter your cycle, to make your cycle to be irregular. So if you know you have emergency every day, please, you can use choose other methods of the family planning. So the third one that we discussed is the pull-out method. Okay, so the pull-out method there, the pull-out method, so this is for the men. Okay, is not reliable. Then the fourth one that we discussed is the barrier method, so which is the condom. So we discussed about the male condom and then the female condom, so, and also the cervical cap. So you need to be shown on how to use it so that you don't put it wrongly. All right, so and then the sixth one, injectable. So you take it every 3 months. It's short of an injection. Take it every 3 months. Once you take it, it releases the hormones into your body system. So it prevents pregnancy, thickens the cervical mucus, thickens the uterine lining. Okay, so does not allow fertilization to occur. So the seventh one is the IUD, the IUD, so the intrauterine device. So I said it's of two types. So the one that is made up of copper, the other one is rich in hormones. So the eighth one is the implant. Okay, so the implant, like I said, it's placed under your arm. So once it's placed under, it releases its hormones into your bloodstream. So it prevents pregnancy, and then thickens the cervical mucus, thickens the lining of your uterus. The side effects of these implants that can cause weight gain, makes your breast be tender, and some irregularities in your body system. Okay, then acne breakout. Okay, so those are the few side effects. However, this method is effective, like 99% effective. So the ninth one is the permanent method. For the male, we have the vasectomy, where the tube that carries the sperm are being cut off and tied. Okay, so that means no sperm comes through that way anymore. So the other method for the female is the bilateral tubal ligation. So the both fallopian tube are being cut off. So cut off, and then that's it. Okay, so see you in the next video.